When you're working with someone, it is very paramount to understand an individual's preference, their goals, and what it is that they're aspiring to do in life. I think we have come to an understanding that each individual is unique, and what people want to achieve looks different to each person that we work with. We have worked with quite a lot of people who've had very complex and challenging crisis situations, and when they come to us, they just want to feel part of something that's bigger than themselves, and just trying to understand what is going on and how can I live a different life, be fulfilled and feel well. So we do that by creating care plans, collaborating with the individual, having a sense of what it is that they really do want to achieve, sitting down with them, breaking down the goals.
Working for Catalyst Care Group, we value and we pride in our family, impacting and teaming. And when we have someone coming to our services, we want to give them that. We want to give them a safe place, like a family home that provides safety, and that they reassured that we can build trust by being consistent with them, by also asking the question from the beginning, what is it that we can do? What is the end goal from the beginning? So for someone, it should just be to provide the safety, accommodation, or to help them through that journey. So we'll be looking at the beginning of the journey. How can we help this person? And have we got the right people with the right skills? And can we execute the plan, which will be hopefully to keep that person safe? Do we our clinicians trained? How can we establish a team that can go and provide the care that's required for that certain individual?
So, yeah, I think that is one of the things that has really struck me about starting to work with Nurseline Community Services, because we do work with people that would otherwise be in hospital, whether we're preventing an admission or whether we're facilitating an early discharge from someone that would otherwise been in hospital and has been in hospital many years. We are working with a level of distress that is incredibly challenging to manage. And the importance of teamwork, the importance of a philosophy of care, the importance of a belief in recovery, that these times of crisis are temporary. And again, there's that saying, isn't there? This too will pass, because it will pass. It is only temporary. And in actual fact, the next time the crisis comes, you can learn from the one before and actually try to work out what happened before that crisis so that you can preempt the next one happening. So I think beginning to work for Nurseline Community Services, the level of distress that people experience and the way that our clinicians manage that distress is astounding. And I haven't really seen that level of care and compassion for many, many years in mental health services. It's fabulous what they do out there. We owe them a lot.
I think from the start, when we are working with someone, it's always important to have a perspective from different people, and that perspective need to also include family and friends, because they have known the person longer than anyone else, and their perspective can be very insightful in understanding some of the challenges that that individual has. So as an organization, what we try to do is we try to make sure that we share that education with the families, we involve them in the day-to-day things as much as we can, wherever appropriate. We involve them in maintaining that level of contact. So as much as we do amazing work as professionals, the individuals that we work with need to live fulfilling lives outside. So they need to stay connected to their families, they need to stay connected to their friends, and we help them foster those relationships.
When we work collaboratively and co-produce our risk assessments and our care plans, we become more effective in delivering care that is cohesive, care that is safe, care that is received by the individual, and they want to take the risk with you because at the end of the day it's their life. One person that I have supported recently wanted to go on holiday abroad, which is lovely because everybody wants to go on holiday somewhere. But that's a big goal. So we started working on how can we bring it close to home while we are working with the individual's goal. How can we help them to achieve the smaller goal to attain the bigger goal, to have a sense of achievement, to have a win? And we did that successfully by working with a multi-network of individuals who have always been supportive in the way that we collaborate, we sit, we discuss, we hold the risk together as a network.
And you have this moment where you have a connection with that person and you just say to them, you've still got control over this. This is still your choice. You can still influence your care, your treatment, your outcomes. I think that's a magical moment, and that is the magic actually of mental health nursing, and that's what's kept me in it for so very, very, very long, because those moments are what makes the world go round really. That magic, that kindness. But I think being able to bring the benefit of many, many years of working with so many different people in so many different situations, that moment of connection when a light bulb comes on and you see it in someone's eyes and you have that connection, it's magical, and that is the beginning of recovery.
It's not a straight road. Sometimes it's a zigzag. We go up, we come down, but we're always holding the hope that things will get better, and they do get better.